how does your environment, including your emotions, shape what your genes are expressing or repressing?
There is so much information out there that's free and accessible, but I think the struggle people have is navigating their way through that.
There's a pharmacy up there. It's actually okay to slowly try things out. And if it's not right for you, you just pivot and you do the next thing. We've bred generations of people that want the sledgehammer for everything, that don't give any credence, kudos, or time to the small things. This is not prescriptive, but
Dr. Olivia Lesslar, an Australian-educated medical doctor with a background in psychoneuroimmunology and longevity medicine. She specialises in tackling complex, multi-systemic conditions such as neurodegeneration, allergies, and autoimmunity, using a unique blend of integrative approaches and cutting-edge science. Dr. Olivia collaborates with top international clinics, including clinics in Los Angeles and Sydney, lectures at leading institutions, and is a sought-after expert in biohacking, neuroplasticity, and preventative health. Get ready for an insightful conversation on optimizing your health. I wanted to talk about one of the myths I think that comes up quite often is this idea, we were talking so much about change and the things that we can do to implement change in our well-being. But one of the myths I've seen a lot on social media is around this idea that genes determine our health. So it's almost like this set pathway that we cannot shift or change. And I just wanted to hear your thoughts on that.
yeah. So the Human Genome Project, when it was first started, everyone was very hopeful because they thought that the minute we unlocked the genes, then
Mhm.
it would be the key to every disease imaginable to mankind. And that was not the case. First of all, they're a lot more complicated than people realize, including doctors, including myself. Second, an onion has got more DNA than we do. And we're not that different to like bees or bananas. So there's the genes and then there's the epigenetics, right? How does your environment, including your emotions,
Mhm.
shape what your genes are expressing or repressing? So the genes almost have the repository of everything, but what what is being expressed is going to be the risk factor or the sort of plays a bigger role in disease processes or psychological states or whatever. So a very famous epigenetic study would be the Dutch famine study, whereby they showed, and also the China famine study, but where they showed that in a generation that was exposed to famine, it turned on certain genes that meant that your grandchildren were more likely to be obese. And if you think about your body trying to protect you, from a 10-foot perspective, so it's not just you, right? It's your lineage too, because
Mm.
we're a species that want to survive and procreate, right? And so when you are exposed to something that's going to harm your health, your survival, and your ability to procreate, your genes are going to turn on to try and make sure that this never happens again, right? Especially if you manage to survive whatever that was and then have children. So
Mhm.
these people will have grandchildren where FTO gene, for example, genes, there's several of them. The FTO genes have all been switched on so that you are more likely to pack on if you eat foods, because your brain, your body, your cells, your genes remember. The body keeps the score, right, from a genetic perspective.
Yeah.
And so, and that's why genes themselves, they're not a determination, honestly. The number of people where they have this fatalistic view
Mhm.
because of what the media and doctors have portrayed genes to be, because think about it, there are definitely some diseases which are due to genes, 100%, right? Huntington's, for example, if you have that gene, it's going to happen at some point.
Mhm.
But those are actually very rare,
Yeah.
really rare. Um, Everything else, it's multifactorial. And then genes wind up paying maybe 20, 30% at best. That's what the literature says. Okay.
Yep.
And then, so what does that mean? 70 to 80 to 90% of whether or not you get that disease is others. Exposure to chemicals, lifestyle factors, behaviors, whatever. And so I think that if you believe that your disease, your anxiety, your depression is 100% due to your genes. Well, look, my father has depression, my grandfather has depression. You then float along the river of life a victim to your genes. Nothing can be
Mm-hmm.
done. And when you think nothing can be done, nothing can be done because you are so
Yes.
powerful. Your brain is so powerful. So the placebo effect is if you think something's going to benefit you, it will. And the nocebo effect is if you think something's going to harm you, it will. We're talking about trials here where you take a pill, a sugar pill, and what have you, right?
But I
But
think I just want to stop there, sorry, just highlight that because what
please,
you're talking about that people may not understand is I think people do understand the concept of a pill, the idea
mhm,
that like if we take the pill, then
mhm,
we think something's going to happen if we don't. But what you're sort of saying is that this is also about the beliefs that we have. So
mhm,
if we have this belief that
mhm.
I'm going to have depression always, I can't do anything about it, then therefore we will start acting in ways that will reinforce
As well,
that
exactly, because it
outcome.
changes your
Yes.
behavior.
Yes. So the way that we think about it is really, really important.
Hmm. And the placebo and nocebo effect is proof that healing or not starts in the
Mhm.
brain. Your mind and your body are so powerful. They will concoct all manner of chemicals to give you the outcome that you think that you are going to get. There's a pharmacy up there or down there, wherever.
I love it. It's
Right?
so true, though. I love
It's
it.
so, and
Oh,
but
my
I
little
don't, of
pharmacy in
course,
my brain.
right. But both of us, I can see that you're a super compassionate practitioner. Neither of us are saying to patients, it's in your head, as if like if you don't get better, then it's your fault. And if you get sick, it's your fault. No, we're saying it's so complex, but
Yep.
we're trying to then encourage you to take on as much as you can, when you can, if you can, right? And maximize that. Now, it might only give you back 1%, but 1% is better than 0%. And it may give you back more
Absolutely.
than 1%.
Yeah.
And when I'm talking to my practitioners and doing workshops about psychoneuroimmunology, I love the idea that these tiny, tiny changes, it's only 0.5%, let's just say, right? The how you breathe, the making sure that you give gratitude for the food that's in front of you, the chewing and the smelling of your food, and making sure that you express your love, affection, gratitude for the people around you, or whatever woo-woo stuff you want to talk about. It's just 0.5%. But 200 times 0.5%, that's 100%. So
Yeah.
the little things matter. In medicine, we've been doing this for so long where, we take sledgehammers to everything. And when we do crack open that walnut with a sledgehammer and you're able to like eat the piece of the dust of walnuts that's left from the sledgehammer and you call that a success, we've bred generations of people that want the sledgehammer for everything, that
Yes.
don't give any credence, kudos, or time to the small things because it's small, it's tiny. What difference is that going to make? Every um, great PT out there, life coach out there, health coach, they know that it's the small little habits, the small changes that we make that eventually are going to give you the biggest bang for your buck collectively, compounded. It's not these big things, That's why, like, retreat. I love retreats. Don't get me wrong. I love retreats, right?
I do retreat. So before you diss them,
No, I love retreats. I love retreats, right?
no, no,
But
no. I
like,
know exactly where you're going, and I'm on
okay,
the same page. I'm on the same.
good,
I do
okay.
couples
Because,
retreats. Yeah, yeah.
if
It's a
you
bit
go to
different.
retreat, that is a week-long thing of like juice fasting and yoga every morning and then breath work in the afternoon and then red light therapy before you go to bed in your organic cotton sheets, you are going to reset for sure. But if
Mm-hmm.
you're not also given tools so that you may take the fundamentals out of a retreat and implement it in some way, shape, or form in everyday life, you're just going to go right back to where you were in 6 months and have to do another retreat. Now, I love retreats. I just said I like doing retreat because right, it's my time, it's my downtime, it's my me time. But I
Yeah.
understand because I've had fantastic colleagues like yourself explain the importance of making sure that we learn something from retreat. It's not us,
Mm-hmm.
being a victim to these external forces, zero internal locus of control. Anyway,
It's
so
not real life. Like, that's the whole point. It's not real life. So for me, like, I do couples therapy retreats, and, like, what I love about it is that it is actually kind of a bubble, so you get to step back from everything, you get to focus. But the key for me is, like, I want you to learn the strategies. I want you to have those shifts here so that you can go back to life and implement them. And this is just more like a focus kind of session of that allows you to give that time and that energy and get some energy, because we're talking about couple relationships where, they're usually quite busy and have kids, etc. You can have that condensed time, but nothing changes
yeah.
unless you take what you've learned and you apply that back in
When's your next
everyday life,
couples retreat?
every day.
I
You
want to
want to
sign
come?
up for me and my partner.
Not sure with next group. I've been doing a lot of more intensive therapy 3-day ones at the moment. Um, yeah, I do love it. But yeah, I think a lot of what we've talked about is really this idea of empowering people around change. And, we're talking about genes, and we're talking about the idea that people get stuck thinking they're on this trajectory. And, it's something I am passionate about because I find it really heartbreaking in terms of mental health. I've had so many conversations in the perinatal space where mums or dads are so fearful of having children because they're worried about the genetics that are going to be passed on, particularly if there's a mental health presentation. Um, and just being able to work through that and explain all of the things that impact mental health that we can control, that we can influence, is so important. So I'm wondering if you can tell me, what are 3 things that we can do to improve our well-being?
Well, actually, I wanted to just make one comment about like
Yeah.
parents who are afraid, because I totally get it. Like, I mean, I still don't have kids, and I would hope that maybe I would one day. Well, the clock's ticking. I've got like literally like 6 more months. Come on, but it's a countdown timer on my bedside. No, uh, but so I understand that fear, right?
Yeah.
There are studies to show that in women who are pregnant who are stressed, and
Yes.
the society and the partner can really help in this regard, where we are a soft place for that pregnant woman to land. We need to help her and support her like the old village style, right? Because
Mhm.
stressed women increase group, the production of stress hormones, right? Which then impacts the receptors for those stress hormones, glucocorticoid
Mhm.
receptors, and that actually changes the glucocorticoid receptor density in the babies that are born. So, you know, i- i- the support aspect for women, which honestly, I don't know how many more years we have to keep banging on about this. We really need to take this seriously.
I know.
Oscar Serelak, who you probably know, he wrote the book, the postnatal depression book, talking about
Mhm.
women just not being supported and needing more nutrients and needing more help. Like that is this, it's emergency, at this point,
Mhm.
I think. Anyway, okay, what was the question? Three. Um,
I wanna respond to that one now, though. We're getting off track, but I think, that is so important. That's actually how I came to start in couples therapy, actually, because I worked in an infant clinic during, when I was doing my registrar program, and I really noticed that with women. Like, I was sort of like, we're bringing them into this room, and I was getting really great outcomes, but I just felt like there was this kind of, like, roadblock, and
mm,
it, dawned on me that it is that external support. And so,
mm,
as I went into perinatal psychology, I always brought the partner into
mm,
sessions because that context is just so fundamental in the transition to parenthood. especially in our society where we don't tend to have all the other supports that we do in other cultures, that the relationship just becomes so important in terms of the immediate support and then drawing in resources as well. So yeah, I absolutely agree with you that we need to do better on supporting women during that transition. But yes, 3 things that we can do for our well-being.
Well, okay. Well, this is not prescriptive, but look, you know, the place that we spend the majority of our time is in our workplace and in our home. So especially with our home, we get to do what we want with it. So we get to change the bulbs. We get to turn off the Wi-Fi when we're sleeping. Things where we have control and they're not difficult things, not expensive things. That's where we need to stop. So it's like I said, I have an interest in light and electromagnetism, and they're very, very important. So making sure that you're not exposing yourself to fluorescent light, well, full stop, to be honest with you, and LED lights. But certainly you got to make sure that your light diet after sunset is really important because that's going to dictate your sleep, and your sleep dictates your moods, right? So
Mhm.
REM, rapid eye movement, for example, is emotional first aid. You don't get enough REM and your mood will go out. That's in the studies. So your light and electromagnetic diet that you can control in your home is going to be super important. The amount of leaky energy leaky electricity that's in most homes is incredible. So that's one. Two, I cannot emphasize the benefits of full spectrum light sunlight to mood,
Mhm.
to body, to vitamin D, to your immune health, to, cellular signaling. When you are out in a wide open space and exposing your skin to sun, and of course, there are going to be people asking about, skin cancers and this and the other. Skin science and sunlight exposure is a monster topic. The main things to
Mhm.
know about that is that it's not so simple that sun causes cancer because it
Mhm.
doesn't. So, and UV studies are they're not controlled for light. So you actually irradiate a mouse's skin just with UVB. Yeah, you're going to get DNA damage and you're going to get cancer. But when would you ever have UVB on its own? You wouldn't.
Mhm.
I'm like getting into the weeds here. But anyway, there's a lot more to be said about skin cancer than just don't be in the sun. It's ridiculous.
Uh-huh.
We evolved with the sun. So, full spectrum sun exposure is super important, safely, of course, because the signaling that happens at a quantum level in the mitochondria is undeniable. So
Mhm.
there are protein complexes in the mitochondria that eventually lead to ATP output, right? And ATP being energy, and every cell needs energy to create the proteins and to clean out the mess and to do the functions of the organs that it's in. All the protein complexes are photoacceptors; they're light receptors. And that's why photobiomodulation, right? Red light therapy is so vogue now because the science says, hey, it's super important, but it's more than just
Mhm.
red light, right? So full spectrum sunlight is really helpful for behavior, for mood, for your immune system, as we said, but also for anchoring you to the circadian with the circadian rhythm, and then allowing better sleep. Better sleep equals better immune system, better moods. Okay. And then the third thing is, of course, I'd love to talk about psychosocial and people, but actually, it's not giving up your power. We
Mm.
have so much power with our behaviors, with our thoughts, with modulating our emotions, with the words that we say. The the power in the vibration and frequency of all these things is incredible. And the more we take back our power, the more we realize how much control and agency we actually do have, the less we give up our power to to script writing doctors, the better. Because you know your body best, you know your circumstances best, you know what you're willing to do and not willing to do. And so you actually have the full pharmacy, as we said, you have the full pharmacy in your mind, brain, and body. You
Wow.
have the cheerleading team or not inside you. And if you are not ready for change, if you are not ready to step out of your shell, if you are not ready to step out of your cave and get in the sun and start exercising and all the rest of it, self-compassion is super important. If you're not ready, you're not ready. Don't let
Mhm.
anybody shame you into doing something that you don't want to. Now, could you have some encouragement? Of course. But at the end of the day, you and I both know that there's only so much other people can do for you. This internal locus of control and the self-compassion that you deserve for yourself is going to see you through the whole of your life, because you live in this body and in this mind.
I love that so much. I've never heard that response before, and I just, when you were talking was just, oh my gosh, we could talk about that for
Yeah,
hours. There's
exactly.
just
One podcast just
so
on that.
many layers there. Okay, we're gonna come back again, and we're gonna talk just about that for an hour because that is enormous. It's
Yeah, I
so
had to learn that for
huge.
myself, right?
Yeah.
Like everything I'm talking about is what I've had to learn for myself, what I am learning for myself, what I
Mhm.
struggle with, what I need
Yep.
guidance on, right? I mean, I I'm my number one patient. Just,
Hopefully you're a kind patient.
yeah, yeah, exactly.
Speaking of that, I watched an interview where you were talking about, I think your birthday might be coming up from something you said recently, but you were talking about your 45th year and it being a year that you were dedicating to yourself and to your mother and to patients who may not be getting the care that they deserve. And I wonder, if you can share if someone's sitting in that space where they are struggling with whatever they're struggling with, whether it be health, mental health, and they're seeking support from a practitioner, but they're feeling like this is just not working for me or they're not hearing me. What advice would you give them on finding the right fit for them?
Mm. So my mom died when she was my age, 45, and I turned 46 at the end of March. So this whole year, actually, I look back, it's been a real struggle with a lot of things, with
Oh,
finances,
yeah.
with work, with partners, with lucky my health has been okay. Although actually, I think I've gone into perimenopause. I've started perimenopause. Yay!
Yep. I hear you.
Hooray!
I feel
Um,
you. Yeah.
yeah. So, it's and that's the whole story behind my 45th. Yeah.
Yeah.
And it still I mean, I'm I can be an angry person. And I get really frustrated for patients when I see doctors not being the healer, that they
Mhm.
signed up for. Um and that's something I'm working on. That's something I'm like tapping this out now. I'm like, okay.
I feel yeah, I can have those strong reactions too. I'm very fortunate actually where I live. We've just come back from being in Bali for a while, but where I live, I had a psychology practice here, and we have amazing doctors down here. Like I
Oh,
cannot tell you, I don't know what it is, but I've worked with so many GPs in this area, and they just have such a holistic approach. They're so good at meeting their patients where they're like not everyone, but on the whole, honestly, like it just gives me so much hope.
yeah.
So it helps me deal with the counter of that, but so much hope.
So, in patients trying to find the right doctor in inverted commas, I think part of it is about expectations, right? If
Mhm.
let's assume we're talking about Australia, Medicare, bulk billing.
Mhm.
Uh, bulk billing doctors, um, have to stick to a bit of a script. Otherwise, they can't bulk bill. That's the whole point, right? Bulk billing is about what the government is willing to pay for. And you can't get
Mhm.
angry at bulk billing doctors for not being holistic, because holistic care I mean, obviously what's holistic care, but we're talking about supplements, we're talking about, the biohacking, the hyperbaric oxygen or the
Yep.
pulse electromagnetic field therapy or whatever it is. These things are not on the list of things the government is willing to pay for. And you can't take
No.
that out on your doctor.
And I think the
Then,
other important thing is time.
oh
Like,
yeah.
we're
Yeah.
talking about individualized approach. I spend a lot of time getting to know my
Mm-hmm.
clients, If you're
Exactly.
working on a bulk billing model, you do not have time.
No,
You've got
exactly
10,
that.
15 minutes to
Right.
get someone's whole history. How do I really feel a lot of compassion for those doctors, to be
Oh,
honest, because I think
absolutely.
it's an impossible task.
Yes. And there's an algorithm, right? If you have a fever, then this is what you give them. If you have
Yeah.
a anxiety, then this is the question that you ask, and then you refer them on to a
Mhm.
psychologist, or this is the medication you give them. And if that medication doesn't work, you increase the dose. And if that doesn't work, you add on a second agent. Like there is an
Mhm.
algorithm to this, right? Your doctor
Mhm.
can't keep going off piste because they're going to get investigated by APRA. So it's about expectations. What are you actually expecting your doctor to do for you? Because if they're not getting the algorithm right, you're not getting that basic pharmaceutical referral care that you deserve and expect from a conventionally trained, conventional bulk billing doctor, then you have every right to complain and the government's going to step in because that's not what they're paying for, right? But if you want true holistic care and functional medicine doctor is too expensive, and I totally get that, right? Then there is actually so much great advice out there from trusted doctors, trusted sources, whatever that may be, because people actually give away a lot of information for free. They do, right? And it may not feel like it's you're having your hand held and you're being cared for in a way that someone would if they were just with you in a room. But right now, what we're trying to do is we're trying to formulate a plan for you that works for you that you can afford. Um, and so then knowing as well that the stuff that you're after, sometimes information about supplements or information about light diets or photobiomodulation, whatever it may be, these can actually be given you by like a really well trained naturopath or herbalist. These people have such a wealth of knowledge that's not, I kind of feel like the average person thinks, oh, because they're not a doctor, then it's not the
Mm.
advice isn't as credible. And I'm just like, I've seen some incredible naturopaths, herbalists, psychologists. Like basically what I'm doing now, I wish I had done psychology before medicine because most of what I'm teaching now is psychology in context of disease
Mhm.
because that's so important. I've seen biomarkers change just with mindset shifts.
Yeah.
Um and so I think that having really good expectations of the practitioners in your life helps you divert your resources as well. Because if you're banging your head up against a brick wall about your GP, about your specialist, that's probably not going to change. Now, are there some GPs who are better than others? Of course. And so then that's where you'd go into the forums and you're getting advice and all that. But unfortunately, in this day and age, yeah, the doctors who are better in inverted commas, they're gonna cost a little bit more. And we're just not
Mhm.
Australia's not a society that has been used to paying for healthcare because of Medicare. Whereas, I'm in the US as well, and people are used to paying. So that's not it's a different type of expectation that's on the doctors. And the doctors, because they are almost competing against the other doctor down the road, they are keeping up to date with like all these weird and wonderful things because if you don't, they just go down the road to someone else, right? So sometimes universal healthcare can keep us universal healthcare was meant to be the safety net. It wasn't meant
Mm.
to be the the be all and end all of medicine because it doesn't encourage or foster innovation or thinking outside the square.
And, because of the way it's funded, you don't get a lot of focus on prevention, unfortunately.
Exactly.
So
It's disease care,
that
right?
yeah, exactly. I think, that's one of the reasons why I'm doing this podcast is because I'm super passionate about ensuring that everyone can access like the tools and information they need for change. And my background before I became a psychologist was working in the community sector, so very low socioeconomic communities, removing barriers to access and, all that sort of thing. So I'm super passionate about that. And I think one of the struggles though people have with social media is it's like, who do I trust?
Mm.
Because there is a lot of misinformation out there.
Mhm.
And so that's for me why I wanted to do the podcast was, obviously I'm going to screen a little bit who I select and be thoughtful about that, because I agree there are great people across a broad spectrum of qualifications or experience. Um, and I think that people do struggle with how to find that and how to understand that. So they then just go to, okay, well, you've got the piece of paper. So that immediately gives you credibility,
Mm.
which immediately means that you know something, you're up here, which is not the case. We know that. So I think it is, as you said, there is so much information out there that's free and accessible. But I think the struggle people have is navigating their way through that. So it's, following people like you, seeing the kind of people information that you're sharing. But I'm being serious. Like it is so important because so much of what you put up on your platform is just really clear, easy strategies for people to be able to grab and implement, and they're invaluable. So I think that is so incredibly important. So obviously all your details will be in the show notes.
Thank
But
you.
before we wrap up, I want to ask you a question because I often think about this myself.
Okay.
What if you had a magic wand and you could impart any skill or any one piece of knowledge to everyone out there, every human, what would it be?
Oh, Katie. Um,
I know, I'm just getting your brain like roasting right at the end.
mm, making mistakes is okay. Making mistakes with your health, with what you say, with how you interact with people, it's okay. It's very closely tied to self-compassion, to be honest with you.
It is, yeah, I love
But,
that.
patients, let me just go back to my complex chronic condition patients. Patients are constantly looking for the next big thing and, that one doctor that's gonna give you the magic bullet. Well, the magic pill, I hope. The magic bullet.
Hopefully not.
I think that's illegal still. Um,
I'm pretty sure.
um, you know, and it's actually okay to slowly try things out.
Mm.
And if it's not right for you, you just pivot and you do the next thing. Because patients put in so much effort to get the right thing done that
Mm.
it's just so full of stress. That's why I'm not a fan of what I think, this is my opinion, the over testing that's done in functional medicine.
Yes, yep.
It's just
I
hundreds
know
and
what you mean.
hundreds and hundreds of dollars of gut microbiome and like heavy metal testing and this testing and that testing and da 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 da. And the fundamentals, the basics haven't even been done first. So when a patient comes in and they're super sick, if you do all this testing, do you know what the tests are going to tell you? That the patient's super sick, right?
Yeah.
But if you at least implement a few sort of basic stuff like just better quality filtered remineralized water that's been structured. Don't worry about that for the moment, but that's important. Um, and the patient is well hydrated. That is a game changer for some patients, because you may have like whatever toxicity burdens and stuff. But if your cells are starved of water or fluid, they're not going to be able to detox properly. So yeah,
Mhm.
I'm not gonna do these special chelations for all these different heavy metal toxicities that you have, blah blah blah. Where really, if we had got you on proper hydration and water and with minerals for X number of months, your body then starts to do what it knows how to do. It detox you.
Mhm.
So I'm not a massive fan of all these tests that we do. Throwing the kitchen sink at it. Um, Straight off the bat. Of course, I do tests because, you do want to pinpoint certain things,
Yeah.
but fundamentals are fundamental, hence the name. So, my magic wand would be it's kind of okay to do those small little things first and move that needle. And if it's not right, you just kind of change because the patients are full of fear. And I get it. right? You're sick.
But
You're
it's only
really
going to
sick.
fuel that fear, when you pull out the tests. And I think about it, we have, in a couples therapy, the government has like a checklist and it's like red, 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 red. Most couples, it's all red. And I know that, coming in, like it's going to be red. That's why they're coming
Yeah.
to see me.
Yeah.
But to sit down and show them that is not going to be helpful, because what is
Mm.
it actually telling them? They know where they're at. And I think what you're talking about is so important. It's just going to increase anxiety and stress, which is then going to impact their health and well-being. Whereas coming back to that fundamentals and going, okay, we've got the baselines in place. So then now that we've crossed a whole bunch of stuff off and we know that we're bringing you back to some sort of baseline stage, then we do the testing and figure out what's still going on.
Yeah.
You are starting from such a better place. You've obviously addressed stuff already, but you're also not adding anxiety and stress
Yeah.
to that person to think.
Yeah.
And
because
the
with
overwhelm
patients,
of like, all these things are wrong with me.
yeah, because with patients, because they're so scared, they want to do everything now,
Yes.
and it's
Yeah.
okay not to do that. It really is.
Mhm.
Trust me. It's okay to slow down to then speed up. Sometimes more haste equals less speed. And so
Yes.
that self-compassion thing means that you gotta give your body some space to do what it knows how to do, wants to do. You just have to give it the building blocks, right? You just have to provide that safe space for your nervous system, your autonomic nervous system, to kind of lean into rest, digest, and heal. So, yeah, it's okay not to do everything, and the self-compassion bit comes in here as well. It's okay.
Yeah, that's a great place to wrap. Thank you so much for your time today and for sitting in the hot seat. Sort of.
I'm actually sweating, to be honest.
Are you?
I am. I think it's just
Well,
that,
you
well,
can't
this.
see it.
Yeah. Oh, good, because right now I look like I have a glow, which is actually a fine sheen of sweat.
You look stunning and you don't look like there's a drop of sweat on you. So you're doing really well. Really well. Thank you. Oh, wow, you are sweating. Thanks for sharing that. I love it. I love it. Well, hopefully that was also a bit of a wellness session for you then. Sitting in
I
the
am actually gonna
sauna.
go out now, turn on the sauna, get my bikini on, come back in, like, for real.
Oh, nice. I love that. It's a bit of a cloudy day here, so it sounds really nice. Thank you so much. It was just so enjoyable chatting with you. And,
Thanks, Katie.
I just, I'm so appreciative of you coming on, sharing your knowledge. And, because it's more than just your knowledge. I can see the intention that you have and what you're putting out there and the way that you are engaging with people and sharing your information. I really,
Thank
really
you.
value that
I
and
appreciate you.
appreciate it. So thank you. And happy birthday.
Ah, thanks very much. Can I also drop my Venmo details, or?
Yes, of course you can. Why not?
I don't have Venmo.
I don't know what Abra would say about that, but we'd both be in trouble.
Oh, dear.
But definitely we'll have all your info in the show notes for sure,
Yeah.
so people can find you and follow you and, get all of the information that they need to head towards the right place for their well-being.
Thanks so much, Katie.
Thank you.
Subscribe for more conversations filled with new insights, inspiration, and practical tools to create a life you love.